Hello guys, everybody. We're going to be playing.
I think I see Dan.
Everybody here?
Yeah, I'll speak up. You still can't hear me? I thought we had a lot of echo problems with the building. I'm surprised that you guys can't hear me.
Where's the volume on the back of the speaker?
Oh, don't hold it in front of the speaker.
Yes.
Yeah.
Try to just turn up one of them. Oh, that's too many. Yeah, there's too many switches there. Hello? That's no. I think you put us down. Yeah, that's better. Can everybody hear? That's too loud. I gotta stay. So I was asked to talk about belly pain. I guess that is something that you guys all encounter here at the facility. You know, we have all had tummy aches or belly pains during our lifetimes, but the important thing is to try to figure out which tummy ache or belly pain is a serious problem versus the one which is benign or non-serious. So in order for you to figure out what the problem is with the belly, you got to know what's inside the belly. If you've got no clue what's inside the belly, you can never figure out what the problem is. So this is just a basic picture that I took from a book, which kind of shows you where things are located inside the belly. So on the right-hand side, you have the liver. Right in the middle, on the left-hand side, you got the stomach. The gallbladder lies right beneath the liver on the right upper hand side. Right in the middle of the belly, you have the pancreas right here. And then of course you have the small intestine in the middle, and around the small intestine, we have the large intestine. So the picture doesn't show you the pelvic area, which is lower down. Usually pelvic pains are more common with younger population, so most of the time you won't be seeing those issues. What I'll do is I'll probably try to pick up a couple of the organs and tell you if there's a problem with that organ, how does the pain present, and how to diagnose that, or how to be suspicious. Can you just So as a general rule, if you have a person who's complaining of abdominal pain, and you are allowed to only ask one question, regarding that pain, the question I would ask is, how long have you had this pain for? So that's the most important question that somebody can ask. Now, the second question that you probably want to ask is about how severe the pain is. Is it the most severest pain that you've ever had in your life? So these would be the two most important questions. Now, a couple of other things about abdominal pain. There are some things that you need to look out for, and if you find one of those things, it means most likely the pain is is coming from something which is very serious. So one of the things would be if a person has bleeding or rectum along with abdominal pain. That usually means something serious is going on with your large intestine. If somebody has blood in the urine along with abdominal pain, that signifies that there is something serious going on. If you have somebody who has abdominal pain and they tell you it's the most severest pain they've ever had, it's most likely something serious going on. If somebody has fever and now they have abdominal pain, they probably have something very serious going on. A couple of the other questions that we were taught as medical students, you can ask the patient, which will help. One question would be, do you have to keep, no, let me rephrase it. So the question would be, any type of movement, does it make pain the worse? So do you have to sit still in order for the pain to lessen? So if the person says, if I'm sitting still, I can bear it. But as soon as I move around, the pain is a lot. So that's a very very serious problem. The other question is, well, it's not a question, it's an observation. If the patient has to move around in order to try to get it better, and no matter which position they sit in, they can't get it better, that's a serious problem too. Usually that's a kidney stone. So the person moves around, is thrashing around and trying to get comfortable, but no matter what position they're sitting in, they're just not comfortable. That's a kidney stone. A person who's sitting still, don't want to move at all, and if you try to move him around, even if you move the bed around and he's hurting a lot, that person should go to the hospital. Most likely they have some type of perforated valve. So what's happening is the lining of the intestine, it all got inflamed. You probably will see those things here because they're very common. The older you get, the more common those things are. So one of the most commonest causes of abdominal pain is gallstones. So people don't have a clear understanding sometimes of how the pain, how the pain happens and how the pain presents. So basically, the gallstone pains most commonly would be on the right-hand side, upper side of the belly. Some people will say the pain goes towards the back. Most of the time, it's associated with nausea and vomiting. So in order to understand how the pain happens, you got to look at you got to see what's happening inside. So basically, what's happening in a gallbladder is people who have stones, as somebody pointed it out. So you got these yellow stones which are sitting inside the gallbladder. So the job of the gallbladder is to hold bile. Now the bile is usually made by the liver, comes through the ducts, and gets stored in the gallbladder. When you eat your meal and eat your food, and the food goes into the stomach, it stays in the stomach for an hour or two, and then it gets out of the stomach and goes into the small, so this is the stomach, and the food goes into the small intestine here. Hormones will, through the bloodstreams, will go back into the gallbladder and stimulate the gallbladder to contract and to release the yellow liquid or the bile or the green liquid, if you want to call it, into the small intestine. And the job of this liquid is to digest fatty foods. So the more fatty foods you're eating, the more your gallbladder is stimulated. So in somebody who's got stones sitting in the gallbladder, what happens is, supposedly he eats a meal, and they will tell you 2 hours or 1.5 hours, sometime 1 hour. After I eat the meal, I start getting this pain. And what has happened is one of these stones moved from here and got obstructed right at the neck of the gallbladder. So that's called chronic cholecystitis. It's a chronic problem. So the patient will tell you, like 1 hour, 2 hours after, especially I have a big meal, eat some steak or ribs or something like that, I usually get this pain. It lasts a couple of hours and then it goes away. And this has been going on for several months or several years, basically. So that's called chronic cholecystitis. Now what happens is the stone, when the gallbladder relaxes, the stone falls right back. So that's something which happens chronically. It's not an emergency. Usually that's the kind of patient who can be referred to a surgeon once he gets discharged. So that's nothing emergent. Now sometimes what happens is the stone comes back here and it gets lodged in there and it don't want to move back. So once it doesn't want to move back now, that pain which used to last about an hour to 2 hours, now it's not going to go away. So they will say, I woke up with this pain at night and it just wouldn't let go. And then, of course, they start having nausea, vomiting, and the gallbladder gets inflamed. So that's called acute cholecystitis, or an acute problem. That's usually an emergency. So emergency meaning the patient should be in the hospital. They get antibiotics, they get, later on they get to see a surgeon, and they get their gallbladder taken out. So, and also I would like to, if you guys have any questions, just ask them, in the middle as we go, so I can kind of keep on clarifying things. Yes, sir?
What makes the cause, what's the cause of, if people have stones in the gallbladder?
So the question is, what causes people to get stones in the gallbladder? So kind of, nobody knows really what causes people to get the gallstones, but there are few features. So if you're a woman, you're more likely to make stones. If you are around 40, then you'll probably make stones. Pregnant women somehow, because of the hormones, it changes the composition of the bile. They tend to get stones. And if you're fair and lovely, the chance is you can get, you're more likely to get the gallstones. So basically white population, usually. Of course it can happen in everybody, but those are the high risk people. Older people now, the ones that we see in the hospital who are sick, who are on TPN, on nutrition, they won't tell you they have belly pain. They just get confused. They look really sick, and you can't figure out why they're sick until somebody really touches the belly and kind of finds out. Now they don't jump when you touch their belly, but they kind of wince a little, when you touch that part. You touch the other parts of the belly, and you don't get that response, and when you kind of go and squeeze in that part of the belly, you'll get that little grunch there. They're too sick to tell you they're hurting. You can't speak. Usually some of them are even on ventilators, but you can feel there is some type of body movement which tells you something is wrong there. So you get an ultrasound and you find out they have acute cholecystitis going on, and that's the reason they're sick. Now those people, we don't operate on them. So what we do is we ask a radiologist to come in and put a tube from the outside into the gallbladder and drain the fluid, basically. Now these people, sometimes you might have even seen some of them at the nursing homes, they have a tube sticking out from the gallbladder. So they're very lucky somebody figured it out and saved their life. Otherwise, it's a 100% fatal condition. But again, somebody's got to look for it. Patients don't complain about that one. So rarely, I've had some cases where people will have gallstones and they don't have pain, they don't have nothing. All they do is they just keep on having nausea, vomiting after eating food, and nobody can figure it out until you figure it out. So let's move on to any other question on gallstones or gallbladder. So now what we can do is, let's go to the kidney stone. That's an interesting one. Right here. So kidney stones is a common problem and a common cause of belly pain. So you got two kidneys, one on each side, and more commonly kidney stones do not cause abdominal pain. So you will not get people complaining right here in the belly. You'll get people complaining of flank pain. So flank, for people that don't know, would be an area which is right here. So if you put your hand behind like that, that's the flank. So they will complain of pain in this area. Now the difference between, now you can get back pain also, which is right there. And the difference between the back pain and kidney stones would be, back pain, if you ask them to bend over or twist around or things like that, they will tell you it gets worse. The kidney stones, on the other hand, you could do whatever movement you want to do and the pain would not change. A true kidney stone is extremely painful to say. And most of these patients, they will be thrashing around or moving around, or even some of them I've had sitting in my office and they can't sit still on a chair while they're talking to you. And I know that's a kidney stone. So the pain would usually be in the flank area. Some of them, the males would say that the pain radiates down and is coming towards the front, down towards the scrotum. These people also sometimes will have blood in the urine. Now the kidney stones, the important thing is, if there is a stone which is sitting inside the kidney, it usually doesn't cause any pain. So the kidneys itself don't give you the pain. You get the pain when the stone wants to move into the tube here. So the kidney is sitting up there, and this tube brings the urine back into the bladder. So once the stone is inside this tube, that's where you get the pain. And you get a special type of pain, it's called colicky pain. Remember I was saying, if you have choices of asking people questions about the pain, so if I had a third choice, I would want to know what type of pain, what's the character of this pain. And when you ask somebody, what's the character of the pain, they kind of don't get it. So you have to give them some examples, and you have to say, tell me, is your pain constant, or does the pain come and go? And usually they will tell you, it comes and goes with the kidney stones. And why does that happen? Because what's happening is this tube here is trying to squeeze the stone out of there and put it into the bladder. So every time you get the squeezing nature of the tube, you get that nasty pain. It lets up a little, gets back up again. Actually like pregnancy probably, like labor, something similar. So that's also a colicky type of pain that you get. The colicky pains you also get with intestinal problems. And what happens is the intestine is trying to squeeze stuff, and supposingly it's blocked, or if it's not moving, then as soon as it squeezes, try to get something out, you get the pain, relaxes, pain feels a little better, squeezes again, pain comes back. So kidney stones are not lethal, they don't kill people, but again, the pain is so severe, most of the time people will end up going to the hospital because they need IV shots and IV hydration. So how do we take care of the stones? A lot of them, if they're small, the stone will just move in, it'll move to the bladder, and then you'll just pee it out. But if the stone is bigger, it could get stuck. It could get stuck in this area, cause swelling of the kidney. Usually the urologist, most of the time if that's happening, they'll put a scope and basically pull the stone out, or they'll give it sound waves, crack the stone like lithotripsy, and then you pee out small stones. Any questions on stones? All right. Once in a while you get a person like this, stone gets obstructed, swelling of the kidney, and then it gets infected, and that's very bad. Let me show you this one here, this young lady. And that's a tricky one, and I've had it a few times, I've seen this, you might see it too. So what it is actually this person has got shingles. They've got this rash on the right side of the belly. So I've seen people getting fooled. They would think it's gallbladder, because the people will tell you that I've got a pain here. Now what happens is sometimes you don't see the rash, because the rash is going to come after 3-4 days and make a fool out of you. So what you think is, you think it's a gallbladder problem, and you're doing ultrasounds and all that, and then, finally after 3-4 days, the rash shows up. Now how could have somebody picked that up before and not get fooled? Well, the way to pick it up is, shingles is a disease not of inside the belly. It's a disease of the nerves, and it's a disease pretty much affecting and showing up in the skin. So what you do is, if you were to check the sensitivity on this side by putting your finger or taking a tissue paper and compare it to the other side, the person will tell you this feels different because all the nerves on that side are irritated. So they will say, well, that when you touched me here is very different than compared to here. So now you know the skin and the nerves are getting affected. So you'll be able to make a diagnosis and say, I think it's shingle. You're going to get a rash after a few days. So we've had people get admitted to the hospital for chest pains because they have pain right here. And then of course after they get a stress test, after they get a cath, then the rash shows up. Yeah, but again, you can easily tell the difference by evaluating the skin sensitivity on both sides. It just takes you a tissue paper to check that. And of course the pain is burning and a little bit tingling, but sometimes people cannot explain you that properly and you get fooled. Let's move on to another one. Okay, right here. So that's large intestine, and right here at the tip of the large intestine, we have appendix. So appendix is one of the, it's actually fairly common. So most of the people think it only happens in children, but I personally have seen at least 10, 15 older people with appendicitis. And young kids, it's very easy. They start having a lot of pain, it's around the abdomen, right in the middle, then the pain goes down there, They throw up, nausea, vomiting, fever, chills, and you're able to easily diagnose it. But in older folks, it's a little hard to diagnose. Sometimes they will just tell you, I have nausea, vomiting. So somebody has to touch the belly. All the secret in figuring out what's the cause of the abdominal pain is, number one, talking to them, asking them what type of pain it is, how long they've had it for, blah, 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 if they've ever had something like this before. But the other thing is touching the people. You got to touch them, you got to touch the belly, you got to feel. So the appendix usually lies in the right-hand side, lower down in this corner. Most of the time, if you will touch that part of the belly, they will jump, usually, or they will tell you, yes, that hurts a lot. Now, of course, sometimes you can't, there are some sensitive people, you touch them anywhere, and they will say it hurts a lot. And what you do is, you touch them at other places. You don't just touch here, say there's a lot of pain, and make your diagnosis. You touch them on the other side and see if they're, so if they're just hurting everywhere, it's not appendix, it's something else, or it's nothing. The other trick that I've used sometimes is, you hold a stethoscope, put it on your ear, you're not really listening to it at all, and all you're doing is you're giving the patient an impression that you're listening to it. And while you're listening to it, you just press hard there. So now they don't suspect that you're doing that. Now, if they have something really serious going on, they will still all of a sudden jump. But if you distract them while you're talking to them and you do your little thing, if there's nothing going on, they won't have the pain no more there. Anyway, so that's a serious condition. Usually presents with fever, nausea, vomiting, but right-sided abdominal pain. And most of these, they have to be admitted to the hospital, and they have to be, the appendix has to be taken out. Now, let's probably, if I have to pick a common reason for abdominal pain, and I think you probably see a bunch of it too at the nursing homes, it's diverticulitis. So everybody's heard this term of diverticulitis. So there's two terms that you use. One is called diverticuli on the top, and the bottom one is diverticulitis. So what's the difference between the two? You're always going to see CAT scan reports, and they're saying that the patient has a lot of diverticuli on the left side, versus somebody who has true diverticulitis. And the difference is this, it's very simple. When we get older, a lot of times there are weak parts in the intestine. And let's switch the picture. So this is kind of an enlarged view of the same thing. So the colon or the large intestine develops a lot of pouches. So these pouches are like small tiny balloons or bubbles, and they can usually be seen on the CAT scan. So when you get diverticulitis, what happens is sometimes particles from the food, there could be nuts which didn't get, or seeds which didn't get properly digested. So they will move through your feces and go inside one of these pouches and basically cause infection there. They don't want to come out, they push on it, they erode it, and what happens is you get something called diverticulitis. So diverticulitis is basically infection inside a diverticulum or diverticuli. So how does that present? So most common presentation would be on the left side. So appendix is on the right side. So on the left side, you're going to find out diverticulitis. So patients usually come to the office, they will say, I've got some abdominal pain, or you could see them we've seen some in the hospital too, and I bet you in the nursing home, they'll say, I've got this belly pain, and you ask them where it is, they can't quite tell you, maybe on this side, but when you touch and you try to push on this side, they don't like it. So if since you irritate that spot, they will usually jump. Sometimes people will have fever with it. Mild cases of diverticulitis do not have fever with it. And that's the trick that you need to know. Diverticulitis can be treated in an outpatient setting. They do not have to be admitted to the hospital. We usually, when we know, we don't even order CAT scans on these people. But then the important thing we do is we see them back in a couple of days, or within a day, or they have my cell phone. and they can call back if they're not feeling good. Or we tell them, if you start running a high fever now, call us back. How do we treat it? Well, you restrict their diet a little bit, make it like a liquid or clear liquid diet. And of course, you guys have hydration, you could use that. And then we also put them on antibiotics. So if you give them the antibiotics, you resolve the infection, and they're usually good to go. I think we rarely have people getting admitted now to the hospital for diverticulitis. Now, the problem is, once in a while, you'll get diverticulitis, but it will perforate, so it kind of blows up. Most of these blowing up things or perforations, they're usually not that serious. They're localized, so they don't spread inside your abdomen. So most of these people, even if they have a micro perforation, they can still be treated outpatient. But again, if you're treating them with antibiotics and they're just not getting better after 2-3 days, then you do need to get a CAT scan, find out if they have a perforation, and sometimes they need IV antibiotics. But that's the easiest one to treat and not to send to the hospital. Most of them, if you don't pay attention, they will all end up in the hospital because they will all get worse. Okay, let's move on. So let's move on to this one right here. Abdominal aortic aneurysm. So that's basically an aneurysm. There's a huge blood vessel which goes inside your belly on the back. Now, aneurysm means that the tube, which is supposed to be about 2.5 centimeters in diameter, just like a pipe, you know, you guys have pipes, it gets dilated over a period of time and now becomes maybe this big or that big. So if you have an aneurysm in your belly, the chances are you won't even know about it. Because aneurysms normally do not cause any type of abdominal pain. So when do you get pain with them? You get pain with them when they tear or when they rupture. Most of these people, they will, if it ruptures, it has a very high mortality. Very few people will survive that, because what happens is all the blood just pools up in your belly, and that's it. Your blood pressure drops and you're gone. But some of them, they'll give you warning before it completely ruptures. There's a little tear there. Pain is usually, so that question comes back, you know, is this the most severe pain? And usually it's the most severest pain that a person has ever experienced. It's extremely severe. They will tell you it starts from here and goes shooting towards the back. Also, and they will look sick all of a sudden. You wouldn't know why they're sick, but they're going to look sick. And what will happen is their blood pressure will usually be a little low, and the heart rate will be quite high. If you have abdominal pain and a person has a very high heart rate, and of course if they don't have AFib, it's usually a serious problem. If the blood pressure, of course, is low, you have you have abdominal pain with a low blood pressure, that's a very serious problem too. So these patients, usually there is an amazing test which we didn't used to have a long time ago, but now we do, with which you can pick up most of these serious abdominal problems, and it's a CAT scan. So you do a CAT. So one of the golden solutions to have, if you have somebody with abdominal pain and you think it's serious, is to do a CAT scan. So a CAT scan is an amazing device which will kind of show you a picture inside the belly and pretty much pick up a lot of things. You can still miss some serious things with a CAT scan, but usually, most of the time, you'll pick up the serious things. So this is one of the things which you will pick up on the CAT scan, not otherwise. It's very difficult otherwise. A couple of other things I want to talk about. One other condition is pancreatitis. So pancreas is an organ which lies right here in the middle, on top of the belly button and between the ribs. And it's pretty common too. Mostly it happens in people who are drinking too much alcohol. So you get alcoholic pancreatitis. So you'll have a history of alcoholism to go with it. The other common cause for that would be gallstones. So remember I was telling you how the stone can get stuck in the gallbladder on the top? Sometimes it doesn't get stuck there. It comes down close to the intestine and gets stuck there. Now the tube which brings the bile from the gallbladder and the juices from the pancreas right at the end gets connected. So what you can have is if the stone gets plugged up there, there'll be a backwash of the pancreatic fluids and the pancreas will start digesting itself. The pancreas usually makes very strong chemicals to digest proteins and fat. So it starts digesting itself. That's called pancreatitis. A very serious condition, and the way it's treated is you don't give a person any food. Now, if you don't give them any food, the pancreas is not going to make any of those chemicals no more because there's no food there to digest. And then, of course, we treat them with fluids because you can't get these people, let them get dehydrated. And the golden test to diagnose the pancreas or pancreatitis is, of course, and if you touch these people right here in the belly and you try to push, there'll be a lot of pain. But it's easy to diagnose. All you have to do is order an amylase and a lipase. And if they come back in several hundreds or thousands, you have your diagnosis. There's nothing else which will cause that except pancreatitis. Most of these patients usually should be treated in a hospital setting because once in a while it really starts digesting itself and the people can become really sick. Other common causes of abdominal pain right on the top would be ulcers, stomach ulcers. I think we all know about it. Stomach ulcers are not dramatic. They've been there before. So a person would say, I usually get this pain, I eat some food, I get the pain. The difference between the gallbladder pains and the stomach ulcer pains, number one is, the stomach ulcers, the pain would start within 15-20 minutes after eating the food. So the person eats the food and within 15-20 minutes, it's not the pain. The gallbladder, remember, the food has to empty from the stomach, go into the intestines, and then the gallbladder pain. So there's a difference of about an hour or two. So gallbladder pain, 2 hours after eating. Stomach ulcer pain, within 15 minutes to 20 minutes. There's another type of pain which sometimes people complain about, actually very common in this country. It's GERD, acid reflux pain. So acid reflux pain, of course, also happens after eating the food. Doesn't happen immediately in 10-15 minutes. Will happen in a couple of hours, just like the gallbladder, because the stomach has made a lot of acid by that time. But usually it's a burning pain. They will say it's like, somebody is like an acid. It's burning, boring, and it's right here towards the chest region. It doesn't happen on the right hand side. Now, actually, I think the major reason you asked me to do the presentation was about a condition called ileus, I think, and that's what you probably really wanted me to talk about. Okay. So yeah. So now the ileus is a condition where the intestine is not quite doing its job. And what's happening is, what's the job of the intestine? Is to move the food around, absorb the nutrients. So now what's happening is the intestine somehow is not moving the food around. So why is it not moving the food around? Well, there could be several reasons for that. And the most common reason that we see ileus is because of abdominal surgery. And that's probably the reason you're going to see it too. So what happened is, and I think that's what I need to talk about a little bit more. So what happens is somebody got abdominal surgery. They had a colon cancer taken out, they had a gallbladder taken out, whatever the belly problem was. And now the patient is at the nursing home, or 2-3 days after the surgery, and they're not moving, the bowels are not moving. So we expect people who have had surgery, abdominal surgery done, that the bowels might not move until 5 days. And of course we feed them through IV fluids, sometimes DPN, but by the time these patients get discharged from the hospital, the bowel has moved once at least. Nobody gets discharged after the surgery to a nursing home without ever having a bowel movement. You gotta have 1 or 2 bowel movements before they will let you go. You gotta eat something before they will let you go. Now what you can do is, if you don't take care of them properly in the nursing home, you can put them back in the ileus, and then they end up back in the hospital. So the commonest reason after the bowels have moved and now you're causing an obstruction again would be narcotics. So narcotics now are the commonest cause. And what do? They slow down the intestine. Slow down, they relax the muscles of the intestine so there's no movement. So if there's no movement and the person is eating, where is it going to go? It'll come right nowhere. It's going to come right back out. So the commonest symptom of ileus would be, of course, people will say, I've got some belly pain. And then they will also have a little distension, because now the food is going in, the gases are being made, they're not getting out anywhere, and they're just piling up here. Now they're piling up here, so if you ask them, are you passing any gas? And usually the answer is no. So they've stopped passing gas Now, I wasn't talking about burping, I was talking about down there. So they're passing no gas down there. That means there is a complete obstruction, or the intestine has stopped moving. Belly distension, and then if you let that go for a couple of days, now they're going to start vomiting. So nausea, vomiting, belly distension, no passing gas, that's your ileus. If a person had a surgery, some type of surgery, now not the hip surgery, usually it's got to be some type of intestinal surgery. Of course, people can get ileus after hip surgery too, if you're just giving them too much narcotics. So you got to keep a track of, are they having a bowel movement or not? So if they haven't had a bowel movement in 2-3 days, you should have picked that up a little earlier. Now, what do you do to prevent it? Use less narcotics. Don't overgive the narcotics. The other thing, which we do in the hospital, and you guys have to do it here too, is we get them moving. So if they just sit around in the bed, that will slow down the movement of the intestine. But if you just move them to the bathroom, move them to the chair, just keep them moving. Now these things are good to know, because you could be doing that to your parents, you know, or anybody in the family who's had surgery, because you could prevent that. Otherwise, it's definitely a hospital admission. It's definitely more complications, you know, and unnecessary hassle. So less narcotics, move the patient around, and anybody who has had abdominal surgery should also be getting electrolytes checked, and that should be done like every 2-3 days. So very commonly, low magnesium and low potassium, or abnormalities in the calcium, they will usually cause people to get ileus. Good. Okay. One other thing comes to mind. There's many causes, by the way, of abdominal pain, but I'm just trying to go through some major ones. One other one which comes to mind is, which is a serious one, is peritonitis. So what is peritonitis? Well, peritonitis is inside these intestines, there's folds and lining of tissue which kind of packs it. So what happens is, if the intestine ruptures, what can happen is there's a lot of bacteria in the intestine, we know that. So that bacteria will leak out of the intestine and go into that cavity, but it's not supposed to be. And that usually causes very severe abdominal pain. And if you touch them, they're rigid. So they're very hard, like a board. You know, they would not let you go inside. You know, you wouldn't be able to, it's not soft belly. Anytime you see a hard belly, you're trying to touch it and it's very hard, that's a serious problem. Usually, if they're healthy, they will have fever. If they're very old, they will not have a fever. If you order a blood count on them, they'll have a very high white count. So that's called peritonitis. That's an emergency, and those people have to be, somebody has to open them up and usually take care of them. They have to fix they probably have to cut up the intestine where it's leaking from, and then basically put the intestine back together. What's the time, is it? Okay, any questions? We can talk more if you guys are interested. If you're not bored, I can keep talking more. There's a lot of other causes too.
I have a question about pancreatitis.
Yes.
So you said there is no digestive pancreas. When it's healed, does the pancreas regenerate? Does it grow back?
So what happens is yes and no. It would heal itself. The enzymes would go, you know, the amylase and lipase which leaked out into the blood, they will all go back to normal. But if a person is a drinker, we notice that they keep on causing the damage again. You know, they go out, they drink more, and the alcohol is toxic to the pancreas. So they keep on causing the damage again, so, you know, they don't give enough chance for it to heal. But anybody who gets pancreatitis from anything else other than alcohol, you usually never have a long-term problem with it. Most of the time it'll heal itself. And it'll do a great job, and it'll keep on digesting the food properly. Yeah. The only people that we run into a problem with who keep on drinking again and again, and then you go into a chronic pancreatitis phase, and they start losing weight, they can't digest the food properly, and it's a problem. The most trickiest one, by the way, that I've ever had, I think, and we have lost people because of that. I think my partner, Dr. Chang, has picked it up a couple of times. I've never had, thank God, I've never had to do that. It's called acute intestinal ischemia. So what happens is these intestines, there is a blood flow to these intestines, which is keeping them alive. There's 3 big blood vessels coming off the major blood vessel, the aorta, which supply these intestines and give them blood. So just like you get a heart attack, one of the blood vessels gets blocked, or you get a stroke, one of the blood vessels gets blocked. So if one of the major blood vessels gets blocked in the intestine, that part of the intestine is just going to die. So what happens in that situation is, you do CAT scan, you're not going to pick up anything. It's going to be normal because nothing has happened yet. You examine the patient's belly, everything is normal. So it looks like it's just somebody's fooling around with you. But the pain is so severe that you can't imagine it. So what the secret there is, the pain is out of proportion to your physical exam. So you're touching them, you're looking at them, you can't find anything. In the initial stages, the blood tests are okay. Now if that person goes around for 12 hours to 24 hours, that's it. Then everything is going to become abnormal. Then it's going to start showing up on the CAT scan. But by the time it starts showing up, it's too late. So you're going to have a very high suspicion to figure it out. And usually what happens is you will get a person who's much older. You'll get a person who's got AFib because they're throwing clots. You'll get a person who has bad diabetes and vascular disease, so they've got a lot of vascular disease there. And what will happen is those people will, normally they don't complain of abdominal pain. So you ask the family, how's he, they will tell you he's healthy, he's fine, he doesn't complain of, he's not a irritable bowel type of syndrome. It's all of a sudden a dramatic event. Usually they will never end up in your offices. They always end up in the hospital. Human body is really unique because what it does is, I've been seeing people for years, and when something is going on serious with you, people themselves end up in the hospital. When something not that serious is going on with you, usually we see them in the office. So that itself is somehow the human nature. They get the pain, and somehow the brain knows, I need to go to the ER. I don't need to go to the doctor's office. So somehow that happens a lot of times. We see these people, they come to office for every other problem, no problem. But when they get some serious belly pain, they will immediately go to the ER because somehow you will know this is something which is different. Now, of course, older people who are at the nursing homes, it's harder for them to kind of, they might not have the same dramatic response as we see outside. Anyway, thank you. Thank you for listening.